Hello everybody, this is Miss Kinchin. I'm doing your nutrition lecture for Unit 2, Module 2, and it's life cycle nutrition. We're going to talk about childhood, adolescents, and adults. So I hope you enjoy the lecture, and I'll see you in class. Okay, we're going to start off by talking about childhood nutrition first. Remember, the foundation is always laid when children are younger, and just remember, bad habits are hard to break, and the parents actually produce the blueprint for a child's nutrition and how they're going to do. So also remember that nutritional requirements change as children grow, and it always affects physical, mental, emotional growth and development, so it's going to have an effect on those. There's studies that your book talks about that the mental ability and size of the individual are directly influenced by the nutrition during the early years, so it's really important. Those who have sufficient nutrition, like protein and calories, grow normally, and those who don't may be shorter and less intellectual than those who do get proper nutrition. And it is the parent's responsibility to produce the blueprint for healthy eating, like I said a while ago. So that's really important. When we micromanage our child's eating, which a lot of people do, these can increase emotional and physical problems, and they can become irritable, fatigue, they can be under or over nutrition, and possibly have illness. So make sure that you remember that. So we want to make sure we take good care of our children and how we're teaching them. So here's a slide. It has MyPlate Kids on there. So they actually have for myplate.gov has a kids section on there, and we want to start using this at 12 months old. We'll start using the food MyPlate, and the child is constantly changing, but generally after the second year or during the second year of life, for weight gain, you're only going to see about 5 pounds, and children are definitely going to change. Their focus is going to change from food to the environment, so from their stomach to environment, so you're going to see that change on them. You're going to see some changes in their growth. 1 to 3, there's a lot of changes. Their legs get longer, they're developing muscles, they lose their baby shape then, and they start to walk and talk. And this is when they start to assert themselves at 2 years old. And I'm sure all y'all have heard of the terrible twos, when they start saying no and they want it his or her way, or let them decide. So you'll see some of those changes. So remember that you want to use your food MyPlate, okay, at 1 or 12 months old, and then you're only going to see like a 5 pound increase in the second year of age. I included this slide. It shows the different age groups. We have a 2 to 3 year old at the top left, a 4 to 8, and a 9 to 18, and it shows you the specifics for them and what would be the great MyPlate servings for them. So remember that the children are learning by imitation, so if you can use good eating habits to role model for your children, that's better. And you should always have foods available that are nutritious for snack times, and make sure you provide a wide variety of foods for good nutrient intake. And usually families that have structured meals and snacks and eat at the kitchen table, they're modeling better to their children. And give them like handouts of foods, and how we're going to talk about some ways to develop good dietary habits, but let them be included. We'll talk about that. The most effective approach to feeding children is the authoritative feeding style, and we talked about authoritativeness. And usually there's structure and boundaries around mealtime, and respect for the children's food choices in the context of whatever the parent is serving for their meal or snack. And the parents will make sure the meals are served on time, and they respond to the child's hunger, not just the child wanting to eat, but they respond to the hunger and fullness. And it helps with allowing reasonable choices of food and helps the child to regulate their own eating. So it's teaching them like portion control. So, and then there's a authoritarian, we just talked about authoritative, but authoritarian, and that's insisting that the child eat exactly the way the parents want. So you may see some difficulty with this style of parenting, and so we'll talk about those some more in class. And if families eat together, also that could be a good way to encourage. They found that the children who eat with their family do better in school, they have less risk-taking behaviors for drugs and alcohol, and have better self-esteem. So that's really important. So we're going to talk about some, like I said, some more developing dietary habits in the next slide. So think about your own kids if you have them, or yourself, and what things you've done to develop good habits for them. So like I said, modeling or the imitation of their parents. They want to do what they see their parents do, and keep a calm and relaxing meal time. And that's what we were talking about, the different styles of whether you're making them eat something or not. Nutritious foods available at snack time and meal time, and vary the different foods that you use. Introduce them gradually and in small amounts and make them attractive. And like I said, wide variety. And allow the child or encourage them to help, so they can help make the food list or their what you're going to make for your meal plan for the week, and help them so that they can go to the store with you and maybe purchase them and help prepare them. So it's always good. And limit those sweets. Make sure you're doing natural sweets. You see the apple there, which is a good choice. Encourage physical activity, and there again, like I said, adults, please set a good example. And an idea of a good snack, a healthy snack, might be some cheese and crackers. When we're looking at children and their growth to see if they're within where they should be, there's something called a growth chart. We'll look at that in class. But that's what we can see if we expect them to be growing in their height and weight. So we'll look at that. A lot of children eat small amounts that are nutrient-dense foods, and don't limit their fats before the age of 2 years old. You don't want to fat-laden them, so you don't want to add a lot of fat to their foods, but don't limit their fats. And they can actually have whole milk through the 2 years old, and then after 2 we should do a low-fat or fat-free milk. So fat intake. So for ages 2 to 3, we want 30 to 35% of fat intake, and ages 4 to 18, we're looking at 25 to 35 calories of fat intake. None of these should be more than 7% saturated fat. So don't put salt on the table. Don't prepare with a lot of salt either when you're preparing foods. And remember, young children are more sensitive to hot foods, so they're temperature-wise, and they like crispy textures, mild flavors, and familiar foods. They don't like a lot of sauce or gravy on them. And make sure you set realistic goals for them. Calories can depend on the rate of growth, what kind of activity level that they do, their body size, metabolism, so how fast their metabolism is, and their health, how good of health they're in. So that can all vary according to the patient. Children also can have what they call food jags. So basically eating one or two foods or rituals, things like they may not let food touch each other on the plate. They need a different spoon for the different items. So you might see that with children as well. So keep an eye out for that. And that's not unusual for children. And remember that choking is prevalent in young children. So if they're less than 4 years of age, you want to avoid some foods, and your I believe your book listed those as well. Yeah, peanuts, grapes, hot dogs, raw carrots, hard candy, or thick peanut butter. So make sure you watch those with patients, and or with your children, and snacks every 2 to 3 hours for energy. Finger foods are really good, and remember, nutrient dense foods, so we want things that are healthy. Some other examples would be like cheese, Cheerios, fruit, milk, and unsweetened cereals. Also make mealtime pleasant and food not forced on child. Remember, when they're hungry, they will eat. And forcing foods on children may cause eating disorders. They may have chronic overeating, or they could have something called anorexia nervosa or bulimia, and we'll be talking about those in class. I don't know if y'all have anybody or know anybody that's had these eating disorders, but we'll go over them in class. Okay, so now we're going to talk about adolescents, and we're going to include the age 13 to 20 years old here. And I've listed some of the problems that are common in this group, and you'll see not getting a balanced diet is one of them, or having increased caffeine and sugar intake, especially with the Red Bull drinks and the caffeinated drinks. You'll see a lot of eating disorders, and we're going to talk about bulimia and anorexia nervosa. Adolescents imitate their peers, and remember, during this time they're doing what's popular, and a lot of things that are popular are foods that are they're low in density, and they have a lot of salt. So we got things like potato chips, sodas, candy. They have a lot of carbs and fats, but little protein. And then you're going to see they're needing vitamins and minerals, except for salt. They get plenty of salt because of that, all the salty things they're eating. And you're going to see the adolescent girls are going to need an increase in iron than the boys are, and that's because they're starting their menses. So you'll see those changes. Overall, adolescents need more kilocalories because of the rapid growth and the major changes going on in their body. And you really should start counseling girls at 10 to 13 and boys 13 to 16 about their nutritional health, and continue that counseling. So try to catch them early before they start, this rapid growth. A lot of them have busy schedules, so remember that they've got jobs, they're in athletics, they have social activities, and they're really unavailable for the adult to prepare nutritious foods because they're going back and forth to practices. Mom's busy with all the kids running them. They eat a lot of fast food, so you want to be very tactful with this age when you're talking to them about nutrition, and make sure that they think it's their idea, or give them choices, because they really want independence, and they think that people are telling them what to do, so they might not do it. So boys are usually well nourished in the U.S., just so you know, and like I said, you can have some psychological disorders, the bulimia, anorexia, and overweight. And from poor nutrition, actually, girls may have amenorrhea, where they're not having their menses. Girls are really deficit in calories, protein, iron, calcium, vitamin A, and some vitamin B. So you'll see girls more deficit in things than the boys are at this age. So remember, keep it their idea. So they they'll want to follow their peers. So make sure that you you know, that you make it interesting and give them some choices. So on young adults who we're going to consider 18 to 40, and this would be like young and middle adults, they're trying to find their place. So usually their growth is complete about 25, and they're finding their place in the world. They're making plans, their desires and energy, what they're going to put their energy into. And the best way to increase calcium intake, because you might have a decrease in calcium, is milk, but to decrease the fat. So make sure you got decreased fat. Remember, at this age, they have a lot of social and professional activities going on. They may or may not participate in activities, but it's important that they do to get their exercise. And at this stage, weight control is usually at the top of their concern. So where the last group, they were more concerned about their peers, this group is more concerned about how they look, what their weight is. So in this group, that's what I want you to focus on. Okay, so I don't know, probably many of you don't fall in this category, but 51 years old and up is considered late adulthood. And basically during this time, our physical activity begins to decrease, so we need less calories or less caloric requirements. And we're hoping that that everybody maintains their good eating habits that they had and be as healthy as they can. Remember, good nutrition can help speed up recovery from illness, surgeries, or broken bones, and can improve people's spirits and quality and even length of life. So good nutrition is important. You know, there's a lot of changes going on with the late adulthood, with physiological changes, psychological or psychosocial, and economic changes. So I put here nutrient needs have little change with the energy needs decreasing. So we don't really need to increase our calories or anything. And at this time, you may not feel real thirsty, and maybe you know, you need to take more fluid in, so you may not feel that thirst that you would normally. So it's not uncommon for people to have dehydration and not even be aware that they have it. So here we're going to talk about poor nutrition in the elderly. And malnutrition is a common problem, especially in long-term care facilities that we might see. Food should be familiar and taste good for patients, and we should always offer fluids at meals and between. So when you go in there at the toilet, the patient, you can actually offer them some fluids. We're going to talk about this acronym on the left, determine. But the nutrition profoundly influences physical health and quality of life. So meal times need to be pleasant and a social experience. So if you remember determine, these could be some factors that might affect or lead to poor nutrition. The D is disease, so if someone has a disease. E is eating poorly, so they have poor eating habits. T is tooth loss or mouth pain. E is economic hardship, so maybe they're having economic hardships. R is reduced social contact, so they're more isolated. M is multiple medications. Remember, some medications can cause different things with nutrition. It can cause some dry mouth, it can cause decreased appetite. I is involuntary weight loss or gain. N is needs assistance and self-care. And E is elder years, greater than age 80. So just remember that acronym to help you with that. I was talking about on the right there that some common things in long-term care facilities, and you might see cognitive or physical impairments. So these could be disease processes that affect the emotional disturbance or affect intake. So we need to assist and encourage encouragement for the patients to get that intake. Some of the patients too might be on restricted diets of sodium, fat, and diabetic diets, so you might see that. And decreased fluid intake and dehydration, this could be secondary to decreased thirst. Remember I said they start having decreased sense that they're thirsty. They have decreased independence and they have dysphagia. Remember that, they have difficulty swallowing. Also, if somebody has pressure sores, we need more calories, more kilocalories, more protein and nutrients to help heal. So that's something to look at whenever we look at the patient, what's going on with them. Some of the things that we were talking about was nutrient dense foods. So you want to look at the food and see how many nutrients are in there and how many calories, how many kilocalories in there. So look at the food itself, and you can, you know, looking at the calories, because if they do have issues with, say, pressure sores, they may need the same amounts of nutrients as their younger counterparts need. So you may see that. For constipation, and we've talked about that in class to help with prevention. Remember, we need to include fiber, but with that we need water. So we need something to bulk it up and then help it move, lubricate it out. Changes in elderly in their taste sensitivity, Ms. Helfenberger talked to you about that. So that might affect their nutrition. And I told you dehydration risk for decreased sensitivity to thirst. So maybe they have poor dentures, so they can't chew. And things that would be good choices for them, maybe if they're having issue with dentures or chewing, is something soft. So if we did something like a low-fat yogurt that they could, it's thicker, they could swallow if they're having some dysphagia, and it's low-fat, so that would be good. Some things that are affected with decreased eating, you're going to have you're going to have weight loss, and this can cause some depression. It can and you know, because you can't get around much, but depression can cause decreased eating and weight loss. Remember, they're having a death of friends, so they're not a lot of the people that they knew are dying, and then they're not as mobile as they were, so they're not able to get around as much. So you might see decreased eating, therefore decreased nutrition and decreased weight loss. So also, you know, I wanted to just reinforce this determine, so make sure you look back over that. So this is a slide from the University of Florida, and it talks about the food groups and gives you for a 1800 calorie diet, if you were doing this, what you should eat in these areas every day. So this would be a good tool for you to use. So we're going to talk about nutrients and drugs, how they can interact together. So remember, patients are on multiple prescriptions a lot of times, and they don't realize the consequences of over-the-counter type things with the nutritional state. It can adversely affect the nutritional status of somebody. It may be increasing or decreasing their appetite or ability to eat. It can affect absorption, metabolism, and excretion of medications. Different nutrients can. And especially some of the things that are mineral supplements, they can affect that absorption, distribution, metabolism, and action of some medicines. So, and one example would be if somebody took in a lot of dark leafy greens that have vitamin K in them, and they're on an anticoagulant, it can affect that medication's actions. Diuretics, so we talked about furosemide before in class, so it's not potassium sparing, so you're going to lose potassium. So you may need to increase your potassium-rich food. So the vitamin K, you know, some other things are like different type greens, spinach, kale, those type things. Caffeine is something else we take in sometimes, and it's a stimulant and a diuretic. It can cause nervousness, irritability, anxiety, insomnia, heart dysrhythmias, and palpitations. It can affect the blood pressure and also circulation and gastric secretion, so it could do all of those. As you get older, you have a decreased tolerance for magnesium, so you need to use this in moderation and be aware of the side effects. Sometimes some of these things may resemble a anxiety attack, so if you reduce caffeine intake, it can alleviate those symptoms of anxiety and maybe prevent other medications from having reactions or adverse effects on them. Say somebody is having an anxiety attack and it's related to caffeine, they may have to take another drug to relieve the anxiety. So we're piling a drug on another drug because maybe we could just decrease the caffeine. So look at those nutrients and drug interactions and how they affect each other.